Welcome back to Washington Journal. We're joined now by Representative Mike Lawler, a Republican of New York, and he sits on the Financial Services Committee. Congressman Lawler, welcome to the program.
Thank you. I appreciate it.
Can you start by telling us about your decision to join three other Republicans and sign that discharge petition led by Democrats on forcing a vote on Obamacare subsidies?
Well, remember, just 2 months ago, Democrats shut the government down for 43 days, and they said that the expiration of this enhanced premium tax credit was an existential issue. And so when the enhanced premium tax credit was set to expire at the end of this year, many of my colleagues got together and were talking about what we could do in a bipartisan way to address this. And so we worked over the past few weeks, once the government reopened, to come up with bipartisan compromise plan. And so that plan includes a 2-year extension with income limits, so that somebody making $600,000, for instance, is not getting subsidized by taxpayers to purchase health care, as well as insurance reforms, PBM reforms, HSA expansion to allow HSAs to be used to pay for premiums, as well as to roll over into the next year so you're not stuck in this use it or lose it situation, and to eliminate zero premium plans so that everyone has a little bit of skin in the game and you pay a nominal fee of $5 a month or a $60 upfront fee. This was a bipartisan compromise that we put forward. We worked with Republican leadership to try and get this on the floor for an up or down vote. Unfortunately, for a myriad of reasons, including Hyde language pertaining to federal funding of abortion, as well as the fact that many of my colleagues do not want to extend these temporary subsidies that were put in place during COVID to serve as a temporary enhancement. We couldn't get an agreement with leadership to put the bill on the floor. No. And so that really led to the four of us that signed the discharge being left with no choice but to force a vote.
Now, Congressman Lawler, you mentioned the 43-day shutdown, and now that you are willing to compromise on an Obamacare subsidy extension, why did we have to have this shutdown? Couldn't you have done this in September?
Well, respectfully, the shutdown was a decision of the Democrats. The Democrats chose to shut the government down. I voted every time under Joe Biden, 8 times in fact, and every time under Donald Trump to keep the government open and funded. That is the basic responsibility of members of Congress. So it was never, it was never a question of whether or not I and others were willing to compromise on this issue. We introduced a bill at the beginning of September to extend the ACA enhanced premium tax credit by a year. And if you'll recall, I confronted Leader Jeffries about that during the shutdown, and he said no. He said he did not want to support that. And the truth is, they don't actually want to extend this, they want the issue. That's the fundamental problem here that we're dealing with. The Republicans don't want to put the bill on the floor because they want the tax credit to expire. The Democrats, led by Leader Jeffries, have put a 3-year extension forward because they don't actually want it to pass, they want the issue. And that's why a bipartisan group of us have actually worked together to come up with compromise legislation. So what's going to happen here is come January, when the bill is forced for a vote, it will pass in the House, it'll go to the Senate, and the Senate is going to have to come back with a bipartisan compromise. As we saw just last week when Chuck Schumer tried to force this straight 3-year extension, it failed in the Senate. It did not reach the requisite number of 60 votes to end debate and move the bill forward. So there's going to have to be a compromise, which has been my point from the start. So it was never about me not being willing to. I have been willing to, and we advanced legislation before the Democrats shut the government down. They used that as a convenient excuse. That was not really the basis for the shutdown.
So, Congressman, you said that now that the discharge petition has reached the minimum required, there will be a vote, although it won't be this year. So how does this help the people that have had to already make the decision on their ACA and whether or not they're going to be able to afford it anymore?
Well, again, I think you have to look at the larger issue here, which is that since Obamacare took effect in 2010, the health insurance premiums for Americans have skyrocketed by 96%. And on the open market, which is the core of Obamacare, by upwards of 125%. Meanwhile, insurance company profits have skyrocketed by 2,000%. Why? Because Obamacare was written by and for insurance companies. And so if we want to tackle this issue, it's two-pronged. It's not just the extension of the enhanced premium tax credit, which people need to understand one thing. The enhanced premium tax credit means that the federal government is footing the bill for 88% of the premium. If the enhanced premium tax credit goes away, the premium tax credit is still in effect, and the federal government is footing 78% of the premium for this 7% of the market that we're talking about, the 22 to 24 million people that this impacts. The other, 93% of Americans continue to see their health insurance skyrocket because Obamacare has failed to actually do what the Democrats said it would, which is reduce health care premiums. So how do we actually deal with this entire situation? You need a short-term extension with reforms, and you need to address the larger issues in healthcare, which we started to do yesterday, and every single Democrat voted against it. We passed a bill that would address, for instance, associated health plans, which would allow the self-employed, small businesses, larger companies to pool together to purchase a cheaper insurance plan. The CBO scored it, and they said it would reduce health insurance premiums by 11% nationwide. That is a positive step forward, and yet every Democrat voted against that yesterday. PBM reform, transparency, that was part of the bill. Democrats voted against that. So this is dual track. You can't just try to say this is all about the enhanced premium tax credit, because that's not the basis for why health insurance premiums are going up.
And I'll just let our audience know that if you'd like to talk to Representative Mike Lawler, a Republican of New York, you can call now. Republicans are on 202-748-8001, Democrats 202-748-8000, and Independents 202-748-8002. You mentioned the Republican health care plan. That bill did pass, and you voted for it. Can you tell us why?
Again, because this is two simultaneous issues to deal with. One is the ACA extension of the enhanced premium tax credit. The second is the larger issue of healthcare costs in America, and how do we actually start to reduce costs? This is but one step. When we come back in January, there's going to be another series of bills that we focus on. One of the things that I've been advocating for instance, United Healthcare, the largest insurance company in America, they own providers. That should be banned. You should not be able, as an insurance company, to own a provider, or Aetna owning CVS Caremark. You cannot own PBMs. This needs to be addressed if we actually want to break up the insurance monopoly and start reducing overall costs within the system. You need to allow purchasing of healthcare plans across state lines so that you have more competition in the marketplace, among other critical reforms. So to me, there's a lot of work ahead, but just voting no, as the Democrats did yesterday, is not actually solving the healthcare crisis.
All right,
I look at how we deal with this in a multi-pronged approach.